So we're trying to establish some short ESO training on a quarterly basis that just gives you a couple of new tips each quarter that can help you do your job a little bit better. And so we have 2 quick tips for you this quarter. I'll try to run through those real quickly with you. It should just take a couple of minutes. The first one is doing a system update on your tablet on your first day. So when you restart the tablet and you log in by using your username and your password, instead of hitting the green Let's Go button that you see right below there, go up to the right-hand corner, upper corner of the screen where you see the little circles with the arrows on them. That is a system update. And when you click on that, you'll see Update System Data in blue. You want to click on that. So this is before you log on. You want to put your username and your password in, and then hit Update System Data. And when you do that, you'll see this update comes across. And basically what it does is it updates all of the recent patients so that your lookup of patients that have recently been seen is most updated. And it also gives you an update to any add-ons that we put in on the back end so that your tablet can actually see those. So if a system update hasn't been done in a long time, you may not have the most freshest buttons and options, etc. in ESO, and so you want to make sure you do that each time you come on duty. Once that is done, then I'm going to show you the next thing that we've added in, which is the Mobile Integrated Healthcare Referral button. So I'm going to go ahead and log in now. And we're just going to add a new form so you can see what I'm talking about. As you look across the top in the blue banner, there's Instant Patient Vitals, etc. You want to scroll all the way over until you see Forms, and you want to click on Forms. And you'll notice down in the bottom left-hand corner, you'll see a new form called Mobile Integrated Healthcare Referral. And that gives you a couple of options to do a couple of different things. The first one is it allows you to report vulnerable adults to the Vulnerable Adult Program in King County. So if someone is over 60 or is disabled, then they meet that criteria as an adult. And many of those patients that are taken care of by someone may not be doing that patient a service. And you technically have a legal responsibility to report vulnerable adults to APS. And the first step in doing that can be doing a referral to the Vulnerable Adult Program. While you're on the scene, you might consider calling police so that they can document your concerns. And then you will need to, at some point, report directly to APS. We can help you with that if you do a Mobile Integrated Healthcare Referral to the Vulnerable Adult Program. So simply we just click on that, and it asks you, do you want to do a referral? And so you would say yes. And it says, who do you want to refer to? And there's a couple of options here. So the first one that I want you to pay close attention to is the General Elderly Protection Agency. That's for vulnerable adults. So if we click on that one, then it'll ask you which program you want to refer to, and there are just a couple of them. One is our internal program, which we'll talk about in a minute, and the second is the Vulnerable Adult Program. So you click on that, and then it'll ask you what's the reason for the referral, and you can simply just click Vulnerable Adult greater than 60 or disabled. If you want, you can multiple click other things if you want to. That's totally up to you. But this actually flags this, and this referral goes directly to the Vulnerable Adult Referral Program, and they pay close attention to that. This referral program inside ESO is closely monitored. We have it monitored by 3 different departments that get an email every time one of these things happens, and so we're able to follow up with you. So this just gets the ball rolling, and it automatically sends a copy of your form directly to that program so that they can investigate. So that's the first way that you can use the referral program. The second one is, I'm just going to unclick this here. We're going to come back here, and The second one is referred to EMS agency, and this would be for you to refer patients to the mobile integrated healthcare program that is piloting here in Redmond. So if you have a patient and there are no strict guidelines, if you feel that this patient needs follow-up with us, whether that's a fall patient or a patient who's homeless or a patient who's called you too many times, or has got some mental crisis going on, or needs food, or whatever it is, you can refer any patient to us, and we'll filter those out once we get them. But we want you to feel like you can make those referrals based on whatever you decide is the right thing to do. So you would click on Refer to EMS Agency, and then here you would click on Mobile Integrated Healthcare Program. And the reason for the referral, you can click as many of those as you want, and even if you're not sure, you can simply just click Other MIH Concern. If you think that there's anything that we need to know right away, like if there's an access issue or dogs or protective animals or a possible danger to us that you'd like us to know about, you can click on those flags. And then any comments that you want, you can simply just type them down below. What this does is, once again, it triggers a referral. We get an email that says that you referred a patient to us, refers us to an incident number. We can pull up your record. If you document things in there, we can take a look and see what you've documented. We'll see who it is who wrote the form. We'll make contact with you and see if we can get a better understanding of what you think the needs are, and then we can go out and make contact with those patients. We're hoping that this will kind of improve your overall satisfaction of your job. We know that, as EMS providers, we have about 15 minutes to make a decision on the scene, and we certainly can't solve the world problems in 15 minutes. So we look forward to referrals from you, and our promise to you is we will take each one of those and look at them and see what we can do to help. So those are the two things that we want to teach you this quarter, which is do the system update on your first day after you restart the computer, but before you log in, and don't be afraid to use the mobile integrated healthcare referral button. So that's all we have for you now. Thanks. We'll see you next quarter.